Okay, so if you've found this video, chances are you are experiencing some sort of hair loss and might be considering a hair transplant. I am joined here today by hair transplant surgeon Dr. Chris D'Souza, who is also the president of the British Association of Hair Restoration Surgery, who is going to answer all your questions about why hair loss happens, what you can do to treat it, from the mild to the severe. Let's go. Why do people start to lose their hair?
Well, in the majority of cases, and a lot of men are affected by this, about 50% of men, it's androgenetic alopecia, that's genetic hair loss, so it does run in families, and most men will find that to a certain degree they're going to start experiencing the signs and symptoms of androgenetic alopecia, and that might be loss initially in the temples and also thinning out in the crown. And essentially, it's a sort of slow, progressive disorder where you get the sort of traditional male pattern hair loss over a number of years. It can sometimes start quite early on, even in your early 20s. Some people experience it, or some people maybe even in their sort of 30s or 40s later on as they get older.
So how important is it to catch early?
Hair loss is really treated. You've got the surgical side of things, the non-surgical side of things, and really the non-surgical side of things, it's really important to implement at an early stage. So when someone first starts noticing that they're suffering from male pattern hair loss, there's two medications which are licensed for use in the UK which you can use, and that's oral finasteride and then topical minoxidil, and both of them are very effective, very widely used, and I would recommend anyone who is thinking that they might be undergoing some male pattern hair loss at an earlier age to make sure they're aware of those medications and then have a consultation with someone who's qualified to make that diagnosis and recommend the appropriate treatment.
And just talk me through what those two specific things do.
So finasteride stops the conversion of testosterone to DHT, and DHT is dihydrotestosterone, so that's what's causing that weakening and thinning of the hair. So by stopping the action of DHT, essentially you can slow down hair loss and also actually reverse that thinner or weaker hair into better quality hair. Minoxidil is still not completely understood, but it's been thought to increase the blood supply to the scalp, so it acts more like a stimulant. Potential side effects are always something to be aware of, and that's something perhaps to discuss in a bit more detail with your physician. So, hair transplant surgery, you've got two main techniques, FUE, so that's follicular unit excision, and then FUT, follicular unit transplantation, which is now known as linear strip excision. So the strip technique is still very useful, but it involves taking a thin strip of skin from the back of the head. Main downside is that linear scar at the back, so it's usually reserved for older gentlemen or people with extensive hair loss which require a large number of grafts. FUE is the other technique, and that's probably about 90% of our work now, and that involves taking out follicles individually, one by one, from the back of the head, and in both cases all you're doing is really moving hair from the permanent zone, which is strong, to the front or area of need, to restore that hairline and try and get the most natural appearance possible.
Obviously there is a huge hair transplant tourism trade going on. A lot of people do hop on a plane and perhaps have got a good deal and think that it is a good route to go. How important is it to not just choose the cheapest one and to actually find somebody who is accredited?
In regards to how to choose a surgeon, in the UK I'd recommend anyone to really be looking for someone who's a member of the British Association of Hair Restoration Surgery, and then also the ISHRS, that's the International Society of Hair Restoration Surgery, and currently there's only one qualification in hair transplant surgery, and that's the American Board Diplomat status. So I'd be looking for all of those things. Those are sort of hard evidence that your surgeon is taking things seriously. And then visit the surgeons, maybe have a few consultations. If you are going to go ahead with hair transplant surgery, to do it at a time where you've got some time off. So for the first 5 days, we recommend our patients to be at home, milling around the house. You're spraying the grafts, keeping them nice and moist, keeping it nice and clean. Redness and swelling should be down by day 5, day 6. So I usually recommend video calls or Zooms from day 6 are absolutely fine. And then after 2 weeks, that's when you go back to normal completely. So at that time, again, the majority of our patients say that no one can really pick up on the fact that they've had a hair transplant.
And when can people expect to see the results in full fruition?
Post-op milestones, 6, 12 and 18 months. So new hair only starts to come through 3 to 4 months post-op, and we usually say there's maybe 50-60% of the result by 6 months, maybe 90% by 12 months, then the final appearance is 18 months really down the line.
Well, thank you so much for your time. I hope that answers all your questions on hair transplants and hair loss. And I hope it means that if you are considering one, that you will go to the right person and to the right place. Thanks for watching.